And that is why today is actually called Don't Fry Day. See what they did there? Don't fry. A reminder to protect your skin in the sun. Joining us this morning to talk more about it is our good friend, Dr. Matthew Knight. Great to have you. Thank you so much.
Thank you.
Good to see you.
I like that. Don't fry day.
Don't fry. So this is crazy, but I actually was watching this video the other day, and it was talking about how our skin is not meant to be tanned.
No.
And that it's actually your skin is basically telling you as it's turning colors.
Yeah, that's right. So like
it's having a reaction.
UV light is good for us because it can help us make vitamin D, but too much of it is too much. You know, like the UV index here is set to like fry. You know, really on the far end, and most of us can't handle that kind of UV load. You know, we're the same latitude as like Morocco or like Saudi Arabia, and so it's really tough. You know, we see like 500 melanomas a year at night dermatology, and if you get too much sun, it's a direct shot to not only skin cancer but premature aging. In this country, somebody dies of melanoma every 30 seconds, and you know, Jimmy Buffett died of skin cancer too. Right. And so it's really about dose. You know, to take the point further, if you told me you were going to have a margarita on Memorial Day, you know, we could have a conversation of if that was healthy for you or not. You know, it's not good for you, but it could help you unwind and decrease your stress. But you know, if you told me you were going to have 45 margaritas, it's no good. But if you told me you were going to go on a walk in the morning for 10 minutes, great. But if you said you're going to lay on a pool float all day during Memorial Day, way too much ultraviolet light and a direct shot to skin cancer and premature aging.
Doc, let's talk about melatonin, right? Because we all have different levels of melatonin in our skin. It's what gives us our pigmentation, right, and our coloring. So are certain people more susceptible to skin cancer based on the color of their skin tone?
Oh, for sure.
Okay.
You know, some people have this beautiful God-given protector, but many of us do not. And that's why, like walking into a nuclear facility, you're getting all this radiation, you got to protect yourself.
Yeah.
And the #1 way to do that is sunscreen. There's other ways too, of course, but sunscreen is our big first line of defense.
And I misspoke. It's melanin, not melatonin. Thank you. Producer Anika, she says, it's melanin,
it's okay.
Amy.
They're related, though. It's fine. It's good.
So I want to talk about how much we need. We did a story earlier. We said a shot glass of, you know, skin protection, right? So you look at a bottle like this, and I mean, a shot glass, that's a pretty significant amount that you need in order to cover the body. And then here's the thing. We all have a different body size, right? So it depends.
That's exactly right. Okay. I mean, there's so much nuance to it, but it shouldn't be that hard. I mean, the big thing is you've got to use sunscreen, but like SPF 4 tanning butter from the 70s, no bueno. You know, sorry, Uncle Bob, but that doesn't work. So you know, and the other thing is that people go for the SPF number. They're like, I want SPF 1 million sunscreen, but those things often have very poor UVA coverage, and they have sprays, which, you know, I don't like. But what I recommend is zinc oxide. Right? It's an inert metal. It doesn't have any endocrine disrupting chemicals in there.
What do you mean by that? Endocrine disrupting chemicals?
So that's been in the news a lot. So a lot of sunscreens have things in them that have been in the press for potentially being linked to endocrine problems or reef problems and things, and you can debate that, dermatologists debate that, but zinc oxide is just an inert metal. It's micropulverized, so it's not like the surfers used to have, or diaper paste.
Yeah.
It goes on smooth, sheer, you can barely see it, and it provides awesome UVA and UVB coverage. So not only are you protecting yourself from melanoma, but you're also protecting yourself from premature aging, like wrinkles that no laser can fix 25 years later. So that's why I love zinc oxide. Keep it simple. Look for 10% zinc oxide. I don't care really what the SPF number, 15 to 30 is fine.
Okay.
And then, like you said, you've got to reapply it every couple of hours. The cool thing with zinc oxide is you don't have to put it on at 30 minutes before you go in the sun. You can put it on and pretty much go out. And
it will stay.
Yeah, it'll stay.
And you always talk about this too, and I think it bears reminding, is you're not crazy about the sprays.
No, I'm not, because you inhale it.
Yeah.
And we talked about a lot of those high SPF number sunscreens have a lot of chemicals in them. They're also not stable, and they also don't protect you from UVA, which are the wrinkle, premature aging rays, which is why I love zinc oxide. But there's other things you got to do too, right? Sunglasses, super important, hats, rash guards, and then we were just talking about this. If you have a history of sunburns or you have fair skin like I do, just like going to the dentist, go to the dermatologist every 6 months and get your skin checked. Because
every 6?
Every 6, because early detection saves lives. Stage 0 melanoma, the ones we find all the time, totally curable. It's the folks that don't go to the dermatologist that get in trouble. So if you're at risk, fair skin or have a history of burning, dermatologist every 6 months.
What should you be looking for on your skin, Doc? Like if all of a sudden something pops up that wasn't there before, is that a bad sign?
Oh yeah, that's not good.
Okay.
You know, we teach the ABCDs, so to boil it all down, if it's funky looking and it's growing, go see your dermatologist, because we see so much of this stuff, we can tell you almost right away. Or if you need to do a small biopsy, you can. But just don't wait. That's the problem, is the folks that wait, we saw this a lot during COVID, where 2 or 3 years would go by, and then they would come in with this really angry looking thing. It was invasive melanoma, which can be life-threatening.
Right.
So it's just a good practice, just like the dentist, right? You're probably not going to get a big cavity in your jaw if you go to the dentist every 6 months. You're probably not going to have a big life-threatening cancer if you go to the dermatologist every 6 months.
Well, and the other thing too, and I know you hear this a lot, is your patients probably try to self-diagnose, right? They're online, they're searching, they're like, what does it mean if it has this or that, or if it looks like this, right? But we shouldn't be doing that. We shouldn't be trying to self-diagnose.
Yeah, and there's a lot of people putting salves and things they find online or Amazon on their skin to try to treat their skin cancers, which is also not a great idea.
Okay.
Always partner with the dermatology provider. Get that expert opinion. It's not hard. It's easy to get in and get your skin checked. I got mine a couple of months ago. Just check the box on your health.
I love that you have somebody check your skin for you too,
I
right? Because you can't see everything.
Oh yeah, and I've had skin cancer already, but I grew up here.
Yeah.
So that's why it's super important.
Right. You brought props. You want to tell me what you brought
I want to talk about one thing that always happens this time of year, and it's this Margarita dermatitis. And so this seems to happen a lot with bachelorette parties. I don't know why, but this time of year. But we have these patients that come in, or I got stopped in the street twice last week of somebody that's got these red itchy bumps on their hands, and they're driving themselves crazy. They're, oh, what did I eat, or what did I ingest, or put in,
Yeah.
But a dermatologist will look at them and say, you were making ceviche, right? Or you were cutting limes to put in your Corona, right? And they're like, yeah, I was. And what's happening is that there are chemicals in these plant oils, some of them, like limes are the big ones, but also like parsnips and carrots and stuff. And when you have that, it's fine, but when you're exposed to ultraviolet light, like we're talking about, it has this phototoxic reaction in the skin that causes these blisters, which are really scary looking.
Oh my gosh.
Yeah, and so it's fine. You can cut limes and put them in your margarita. Just make sure to wash your hands and don't go out in the sun afterwards, because really striking. They get blisters and these drizzled, like almost like you've been bitten by, or stung, not bitten, stung by a jellyfish, but it can last 3 to 4 months on the skin.
Oh my gosh.
And people are really miserable.
Who knew? Right, and you would just think, of course, that if it makes you miserable, like it's not good. It's not going to kill you, but it makes you miserable.
It's not going to kill you, but it's visually shocking because they're often blisters that are tender. But it's just one of those party tricks, because dermatologists will look at it and be like, you were making margaritas in the sun, weren't you? And they're like, you know what, I was making margaritas in the sun. How'd you know? And it's because of the chemicals in these limes. So Central Floridians, beware this Memorial Day. Make sure to cut your limes in the kitchen and wash your hands before you go outside.
What if you eat a key lime pie and go outside?
That is awesome. Highly recommended.
Okay. I'll just make sure. Just making sure.
If it's in your tummy, it's fine.
Dr. Knight, we love you. He's the best. Dr. Knight, thank you so much from Knight.